Keystone Quality Transport, Abuse Awareness and Reporting. Some of the images in this presentation may be upsetting. The images are shown to display examples of potential abuse situations. As medical transport professionals, you will come in contact with many clients. Unfortunately, some of those clients could be the victims of abuse. Abuse is defined as the improper treatment of a person, often to unfairly or improperly gain control of the individual. While abuse can take many forms, some common examples include physical, verbal, the use of yelling, degrading speech, mean words, and rude statements, sexual abuse and rape, any sexual activity that a child cannot understand or consent to, and unjust practices. Legal terms to understand when discussing abuse. Commission is intentionally doing something that is improper, such as striking somebody with a fist or slap. These are often associated with physical and verbal abuse types. Omissions are failures to do something. Examples include not providing appropriate medical or dental care, and these are often associated with neglect cases. An often overlooked form of neglect is nutritional neglect. Malnutrition, the lack of proper nutrition, caused by not having enough to eat, not eating the right foods, or being unable to use the foods that one does eat. Another often overlooked form of neglect are unsanitary and dangerous environments. While the legal definition of unsanitary living conditions can vary from jurisdiction to jurisdiction, some commonalities are excessive dirt or filth in the home, poor maintenance of living quarters, a buildup of animal or human waste in the home, infestations with insect or vermin, non-functional utilities such as water, gas, and electric, and broken, unusable appliances such as furnaces and stoves. Visible signs of child abuse can be very subtle signs to significant and graphic examples of physical injury. Visible signs of child abuse could include unexplained or frequent bone fractures, black eyes, bruising in areas of the body not typically injured accidentally or associated with normal childhood activities, human bite marks, circumferential burns on the arms, legs, and genitalia, cigarette burns about the body, bruises shaped like objects, unexplained lacerations and cuts, and also marks around the wrist or ankles, which could indicate that a child may have been tied up. A child may display behavioral signs of physical abuse, including depression and withdrawal from friends and social activities, inconsistent explanation of injuries, unusual shyness, the avoidance of eye contact with adults and older children, excessive fear of caregivers, antisocial behaviors, especially in older children, a child that seems overly watchful or guarded, and a child that expresses a reluctance to go home. Parent or caregiver behaviors that could suggest child abuse include demeaning the child, expressing little concern for the child, their performance in school or other accomplishments, and rarely touching or displaying physical signs of affection. As medical transport providers, The mnemonic child abuse may help you remember potential indicators of abuse. C. Consistency of the injury with the child's developmental age. H. History inconsistent with the injury. I. Inappropriate parental concern. L. Lack of supervision. D. Delay in seeking care. A. Affect or the mood of the child. B. Bruises of varying ages. U. Unusual injury patterns. S. Suspicious circumstances. E. Environmental clues. Elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. Types of elderly abuse can include physical abuse, emotional abuse, and neglect. Additional types of elderly abuse are abandonment, sexual abuse, and financial abuse. Caring for the abuse victim. First and foremost, treat all injuries according to your level of training and applicable medical protocols. Protect the individual from additional harm by removing them from the environment. Even if injuries are minor, offer to transport to an appropriate medical facility. If possible, perform a visual inspection of the patient's surrounding to look for injury abuse risk factors that may be associated with the patient's complaint. Do not question or accuse caretakers in cases of possible abuse or neglect. Do not discuss possible abuse or neglect issues with the victim in the presence of the abuser or other family members. Reporting child abuse and suspected child abuse. Remember that as certified EMS providers, you are considered a mandatory reporter in Pennsylvania. Therefore, you are obligated to report suspected or known cases of child abuse. If you believe that the victim is in immediate danger of death or serious injury, contact law enforcement immediately to get the victim removed from the dangerous condition. Otherwise, the preferred method for reporting known or suspected child abuse cases is to use the Pennsylvania Child Welfare Information System Child Abuse Recognition and Reporting website. Alternatively, you can use the PA Child Line at the phone number 1-800-932-0313. You may also call the Keystone Quality Transport Clinical Operations Team. They are available 24 hours a day to assist you with your reporting concerns. Reporting elder abuse. Again, if you believe that the victim is in immediate danger, contact local law enforcement immediately. Otherwise, report your concern using the PA Elder Abuse Hotline at phone number 800-490-8505. You may also contact the Keystone Quality Transport Clinical Operations Team 24 hours a day. They are always ready to assist you with your reporting concerns. EMS providers. Be sure to document physical findings exactly as they appear. List any signs or symptoms of injury. Also include documentation of the environment and the household exactly as they appear. Be careful not to make generalizations or opinionated comments. remember that your documentation could become part of evidence used in a criminal or civil proceeding. Thank you for taking the time to view this presentation on abuse awareness and reporting. If you have any questions about the content of this presentation, please contact a member of the training and certification team or the clinical operations team. Please complete the abuse awareness and report on Google Classroom.